that I'm gonna go over. It's so easy, actually. All right, let's go back to our PowerPoint. Okay, so let me make sure. Okay. And then I want you guys to have this in front of you. You have it. And then you have it too. And Kuchulu, you can make this a little more organized. So I think it's just on the, it's not here, right? It's just the TV. Do we need to organize this? Yeah, make it a little bit more organized.
Just a little bit.
Just a little. All right, so now kind of like when we did a little practice, it makes sense that the two common area. So if your patient comes and wants to do their frontalis, what are you going to tell them?
That you can't just do that.
And why is that?
Because then you're gonna
Put all the pressure.
This area is gonna be, yeah.
Because that's your bigger muscle. Oh, she's the lovely one that.
Yes.
Go ahead, share your experience. Yeah.
So when I first started doing some Botox, I, like every other patient, was like, no, I still want movement. I don't want too much. So I only did my forehead, and I was very adamant of not doing anything else. So once my Botox started kicking in, I saw that I was getting a lot of overcompensation in my eyebrows, that my eyebrows were super overactive, and I was angry in every single one of my pictures. I came in crying because I was like, I saw the graduation pictures of my little sister. I was like,
know, right?
I'm such an angry bird. I'm so mad. So yes. Yeah. I am the horror story, and will always tell all my
I didn't know whether I should laugh or cry for her, you know, because she was
I was
so
so
stressed.
Yeah, I'm sure.
All right, so as far as the other common area, crow's feet are so easy. Crow's feet are like the TV, just 30 degree, you follow the lines, and there's really nothing can go wrong with doing the crow's feet. One of the areas that we do educate the patient if they need it, we call this the bunny line, the nasalis muscle. Some people have it, some don't. By relaxing the frontalis and glabella, it's possible that patients will be compensating, because this muscle, if it's relaxed, patients will be using that muscle. So take a look at the mirror for a second and make your, like, they call it bunny line, do this. You see those little lines around the nose area? So we call those nasalis muscle, and usually it's between 3 or 4 units of Botox that we educate the patient that, hey, you know, you look beautiful, you look so frozen and smooth, but now you start having these lines. So that's one area that you can educate your patient. The other area that we mentioned, they call it either the smoker lines, or if the patient doesn't want filler, or the patient's upper lip disappear when they're smiling, we inject a couple units of Botox here to kind of give them a lip flip. So can be same thing for the lower lip. 3 and 3 each side is one helps that muscle to become much smaller, or also giving them a lip flip. So go ahead, pucker your lips, look at the mirror. And not only, you know, they call it smoker lines, yeah, but that's just the anatomy of the muscle, that the skin is very thin, the muscle is very strong. A lot of patients may ask you, is this going to affect my speech? Is this going to affect the way I smile? Not really, because we're just injecting like a couple units. It's really small to just relax the muscle. So skin anatomy, you really want to educate your patient. We talk about how your skin and your skin quality is important. Whoever you're going to work with, you want to make sure you do recommend medical graded skincare to your patients, and why everything is related to each other. So we're going to talk about Botox and toxin and all the good stuff. Toxins, as I said, it's like car. Car can be Lamborghini, can be Mercedes, can be BMW. Everybody has their reasoning why they're using Botox, why they're using Dysport, why they're using Xeomin. I have used all three toxin in my practice, and I have done one side Botox, one side Dysport, and I almost got the same result. So I think more than the medication, it also depends on the patient. If the patient has fast metabolism, everybody's body different. Botox is by the Allergan. Allergan is the company that owns all the Juvederm, Kybella, Cool Sculpting. They're one of the top, pharmaceutical company. It's type A anabotulism, and it's been around longer. Dysport, one thing about Dysport that I love, imagine if your patient comes to you and they're like, I'm going to a wedding 3 days from now. They're not going to get Botox and get their result right away. They're going to get Dysport, and within 2 days they're going to see their result. So you have to see which toxin you can recommend to your patient based on their needs, I would say. But in the practice that you're going to be working, if they only have Botox, then that's just the Botox they're getting. And Xeomin is by a company called Merz. Merz been around for a long time. Their neuromodulator is Xeomin, and actually the filler that they have in the market is called Radius, and we'll go over them. As far as dilution, it depends on the practice you're going to be working. Everybody dilutes their toxin differently. I think it's very personal. It depends on how you inject. Some providers use insulin syringes, some providers use 1 ml syringes. So it really depends on the practice. They do like 100 units of toxin with 1 ml. They do 100 units of Botox with 2 ml saline. So it really depends. We can go on and on about how you can dilute it, but Allergan recommendation is 2.5 ml of the saline. I do 1-to-1. So again, where you're going to be working, they kind of will tell you how they like their toxin to be diluted. The more concentrated, the different way you're injecting. When you dilute it so much, then you have to inject more. I know a lot of male providers, and you cannot blame them. They have bigger hands. So it's very hard for them to be precise and be able to inject 1 unit. So sometimes they dilute their toxin. That way, instead of injecting 1, they're injecting 2 or 3, but there's
the same amount.
Same amount, yeah, but it's just I don't know, it's not as concentrated. Because in all seriousness, if you have to inject 1 unit of Botox, but you're having difficulty to be precise, then you dilute it more. That way you're injecting more fluid, but your Botox is diluted. So, all right. So there's some other area, gummy smile. When patients smile, the muscle here, levator labial superiosus, that's the muscle that in some cases when patients smile, you can see their gum, and it's a very easy injection. All you have to do is inject 3 units of Botox to that muscle, and it helps them with their smile, and it's not going to affect their talk. It's not going to affect the way they're talking. So when you do your assessment, they may come to you just for a forehead or for angry line, but I think some people, they don't know they have the option of getting their gummy smile corrected by simply injecting a couple units of Botox. All right. So the other area that I always love to talk about is chin dimpling, because lower face is an area that, as I said, we neglected a lot. A lot of people focus on the upper face. Therefore, the upper face is frozen. The lower face will compensate, meaning the lower face is going to work harder. All the muscle on your lower face, they're a downer. What does that mean? Your DAO, depressor angular oris, it goes down. Your neck platysmal muscle, look, it's a downer, it goes down. So that's why once in a year I tell my patient, I'm like, look, I know we're working on your forehead, your glabella, your crow's feet. It's so important to get your GAO. it's important to do your platysma muscle, your neck muscle, or your platysma band. And in some cases, your chin. So go ahead, take a look at the mirror. Go ahead, do this. Do you see all that dimpling?
Mm-hmm.
It looks like an orange skin.
Mm-hmm.
Yeah.
So it's so easy. All we have to do is injecting the mentalis muscle right there. Your mentalis muscle, not only if you inject it, it will prevent you from having all that dimpling. In patients who have a very small chin, if you look at the chin anatomy, your mentalis muscle has a tendency to go upward like this. Especially people who think so much. It's part of their facial expression. So when you inject the mentalis, it relaxes the muscle. So it also helps to drop the chin. It helps them to accentuate in their jawline. So when you're doing your assessment, educate your patient. Hey, not only it's going to help you to not having all this like wrinkles, it will also help you to have a little bit of a longer chin. Yeah. The other area that is my favorite is your masseter muscle. So go ahead and put your 2 fingers here and clench. Do you feel that? Mm-hmm. Your masseter muscle is one of the biggest muscles in your face. And patients who have TMJ, they're clenching at nighttime, they wake up with headache, you can treat their masseter. When you start doing the treatment, you start with a little bit higher units like 30-30, but as this patient do this treatment, you can decrease your units. So it can be 20-20. But what do you think is going to happen to them as far as the cosmetics look, as far as beauty? What happens when you want to do selfies? What do we do?
Yeah.
Why are we doing this? You see, we're like trying to create that like V shape,
Yeah.
chiseling. So a lot of patients, especially Asian patients, genetically, they have a very heavy lower face, like their masseter muscle. So it's the #1 treatment for Asian patients because one, they do have a very heavy lower face. So it's like you're killing 2 birds with 1 stone. So you're helping them with their TMJ, but you're also helping them to create more like a V shape. Okay? Any question as far as masseter? Nope. All right. So now, let's go and talk about fillers. Crow's feet, brow lift, complication. We talk about the treatment for the upper and lower lip. Gummy smile. It makes such a huge difference.
Yeah.
A lot of patients that they wouldn't smile, they smile now. Because it's just, when you see too much gum,
Yeah.
Mhm.
It's not.
DAO muscle depressor anguli oris. Chin dimpling is huge because again, as I said, a lot of patients look amazing upper face, mid face, but it's the lower face, this area. You can tell their age based on the lower face.
Yeah.
Neuromodulator for mentalis. Oh, right there. Look at the masseter. It makes it look very boxy.
Wow.
Perhaps it will look attractive for a male patient because it makes them more like boxy.
Yeah.
But for a female patient, they want to look slim on the lower face. So, and when you're doing your masseter, if you look at the our little friend there, the only muscle you want to be mindful is called rizoris. This is right there. Where is it? Rizoris, right there. Do you see? It's close to, so this is the masseter, this is the rizoris. This is the masseter. Right there, masseter muscle. And look at the rizoris.
So you need to stay more towards like the outs.
Exactly. Because if you hit the rizoris, you're going to affect their smile. They're going to look like they had a stroke. So that's posterior and as posterior as possible. So when you do their assessment, you mark your patient, you stay as far as possible. Don't come too close to this region because then you're going to hit the rizoris. So that's that. Platysma band, it helps with, making sure that your neck also matches your face. How many women do we see that they're wearing those scarves to hide their neck? A lot. So Nefertiti neck lift is just, you know, injecting the platysmal muscle. Then right here, a lot of people think their neck starts from here, but your neck muscle starts from here. And by injecting the couple units of